most famous physical therapist on the internet.
Thanks for joining us. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet, Brad.
In our opinion, of course, Bob.
Right, in our humble opinion. Today we're going to talk about how to choose the right exercise or stretch for your back pain. This is a problem, Brad. There's a lot of exercises to do out there. If you do the wrong one, it can actually make your back pain worse.
Exactly. And this is, we're going to give you some nice tips from a therapist's point of view. Be very helpful for you.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. You may wonder why we have this mattress sample here. Is because we're giving away a Sleepovation mattress.
Oh, that's Bob, and they're very comfortable.
They're very comfortable, and they're good for back pain, believe me. And they actually are a lot bigger than this. This is just a sample. It has 700 tiny mattresses. Very comfortable. Brad, you can attest to that.
Oh, absolutely. Spondylolisthesis. I can now sleep on my side without having that pain that makes me go, oh. And my wife is happy for it, too.
Oh, there we go. Happy wife, happy life. We're going to go to Facebook. If you want to, the contest will be pinned to the top of the page. Mm-hmm. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. So, Brad, we didn't prepare like this for this that we thought we were going to do.
Well, we really don't need preparation, Bob. We're good. But here are the Sleepovation pillows.
Oh, yeah. I forgot to mention
Don't worry about it, Bob. Here's this one. The thing about these is they have springs in the pillow.
There you can see them.
But you can't feel them.
Yeah.
But if you take it apart, you can actually see them. But they offer
good support for that reason.
And a nice cooling factor with it. All right.
There we go. All right, what I was talking about, Brad, we did repair for the centralization, but I think I can describe it here. So,
yeah, that's all right, Bob.
Well, when we're trying to see whether or not it is the right exercise or stretch for your back pain, if your pain is, let's try, and if your pain starts here and then it spreads out down to the leg, what you want to see is that the leg pain gets better first.
Right.
As simple as that. If you have sciatica, it might even go down to the calf. You want to see the calf getting better first.
Right.
A lot of times, this is surprising, Brad. I found this very quite to be true. Let's say you're having mid-back pain, pain right here, and actually a mid-back problem, it can actually send pain down to here. A lot of people think their low back is hurting because it's right here, and it actually maybe be their mid-back. So you may want to try some of the mid-back ones if your pain is right here. We'll show you the exercises you're going to try based upon what hurts you. Basically.
Right. That's called referral pain in the medical field. The pain refers away from the origin.
Probably a bad example is this, like you have a heart attack. You have a heart attack, you might feel pain up in your jaw, you feel it down your arm.
Right.
And the damage is happening here, but you feel it.
Same concept.
Right, same concept. All right, let's talk about the first one. Let's talk about low back pain, probably the most common one.
Right.
And that's a lot of times people, if you're fall in that category where you bend forward and it makes it worse, when you sit, it gets worse.
Right.
Like when you sit in your car, especially if you sit slouched.
Yeah.
In fact, Brad, we can even do this.
I'm
doing this impromptu. You can actually go to a seat like this. Here, Brad, take that.
Not that that's new. The impromptu part.
No.
Nice.
But you can actually sit and see if you're having any pain. Flex and see if you have any pain, and then you can actually grab the bottom of the chair and pull up on it.
Yep.
And that even puts a little more pressure on your back. And if that flexion causes pain, the first exercise you're going to want to try, especially if you're younger than 50.
Sure.
We'll qualify that. We'll talk about why that's the case. What you're going to try is extensions. So we're trying to extend the back. This is the problem, flexion. So we're going to actually work on extending the back.
That's right.
And you'll do that. You'll want to do it on the floor. You could do it on a fairly firm mattress. All you're going to do is you're going to lie down, put your hands underneath your shoulders, and you're going to press up like this.
There you go.
And so we're looking for, does it, after a bit, does it start to centralize that pain? Does it take the pain out of the leg or out of the buttock? Or does it even get smaller if it's just all right here? Does it get more localized? Then you're doing the right things. So you're going to want to do extension-based exercises if that's the case.
After a bit, you're talking about lay down, and after maybe 15, 30 seconds and starting to do some press-ups like that, That's what he means after a bit. It's not like after laying there for 30 minutes. So
Right.
it's a reasonable amount of time.
Sometimes people just lie on their elbows like this and
Sure.
try the extension like that, watch some TV and see if that helps give you some relief. So that's for anybody who's having trouble when they bend forward or when they sit. So let's say you're a little older, Brad. Let's say you're 55 years old or so. And
That would qualify me.
yeah, that would qualify you. And when you actually bend forward, it actually feels better.
Sure.
So like we call it shopping cart syndrome.
Right.
Like you push a shopping cart, it actually feels better when you're leaning on something like
Right.
that.
And that's called stenosis.
Right. Spinal stenosis,
Mhm.
or in your case too, with
Spondylolisthesis. Oftentimes flexion feels better. Like again, older people for stenosis, you could have spondylolisthesis at any age. So
So in fact, when you stand and extend back like this, sorry about that, you lost me, didn't you?
would you cut his head?
The best part of me, cut that head off. So when you stand and if you actually extend your back like this and you have spinal stenosis, spondylolisthesis,
Yeah.
that's going to hurt.
Right.
Brad?
Sometimes not right away. This doesn't hurt now, but if I did 10 of these in a row, I'm not a happy person for the rest of the day.
Or if you're working in that position.
Oh yes, say no more.
So Brad, what do you want to show a few of the flexion exercises
Sure.
you might do?
Could you hold on to this
Sure.
red ball?
Yeah, sure.
I don't know why we got that ball here. I do too.
It'll come up.
We're going to use it. So, lying down on your bed, on this one, you can actually do it on your bed
Yeah.
or a firm floor. They start out with just a single kneaded chest.
So what you're doing is you're flexing the back now because
Right
that
here.
feels better on you.
Oh, it feels better on me right now. You can do both legs. And if both legs, you can do 5 to 10 repetitions. If that feels good, then, I will actually do this. And I have some other ways to do this actually, but that always feels good. It feels like a good stretch, zero pain in my legs. My low back feels better, and maybe 10 repetitions at the most, and then you can do it later as
And
well.
sometimes you even put your foot up on a chair like this, Brad, and kind of lean forward like this.
Yeah, no, I got a theory on that, Bob.
You think that might be something else?
Well, I think you have to do the SI joint, but I think one way or another, if you do this and it makes your back feel better,
right,
you're gold.
right. And so that's what we care about is how you're responding to the symptoms.
Exactly.
So let's say, Brad, those
Yes.
aren't really the problem, but let's say turning is.
Ooh, rotation.
Like any rotation is
Mhm.
bad. So let's say I turn to the right. Every time I turn to the right, it hurts.
Right.
So what I'm going to have you start with is actually kind of a low-key way of going at this.
So we're talking about standing or seated?
We're going to start, well, it could be either way.
Okay.
Sitting or standing,
Okay.
it hurts with rotation.
Yep.
So I'm going to show you
Oh,
an
yeah.
exercise lying down. So let's say it hurts when I turn to the right.
Sure.
Right, Brad? So what you do is you actually move your legs to the left,
Mhm.
and that simulates going to the right. We probably don't want to do that yet, Brad. We probably want to go to the opposite way.
Yep. Well, the bottom line is you're going to try one way or
Yeah, you
another.
can try both. Yeah.
You're going to go the direction that makes it feel better.
Now you might, even if you turn to the right and it hurts when you sit, this might feel okay
You're right.
because the spine is unweighted.
Right.
So you're going to start working this way back and forth. Now you can go further and further if it allows you, and you can even bring your leg off the edge like this.
What he means by allows you, if it feels good, if the pain's getting better, go a little
We're
more.
right to our new shelving there, Brad.
Yeah, don't kick a hole in the wall.
Now
or
you can
anything.
also vary how much you bring the knee up and then turn.
Yeah.
You can go down here and start. This will hit different parts of the back.
And it is that individual. I've had patients just little subtle movements, and they say, "Oh, that feels good." Then I'll say, "Let's be specific and do it that way."
Now you're going to show rotation standing or sitting.
Right. For that mid back.
Yeah, this is more mid back,
Yeah.
probably more often.
So if the pain is more up here and not down in the belt line or below, and I'll actually have the patient take a stick or a cane. I'm going to use the Booyah stick, and there's a reason I do this is because it forces you to be in good posture, and you put your hands like this, and now I'm in good posture. And also I can actually get a visualization of how far they're rotating by looking at the cane or the stick. And if I go this way, oh, that doesn't hurt. And this way, it's oh, that kind of hurts. So then we're just going to go the pain-free way 5 to 10 times, and then go back to the painful side. If they can go farther, that's good. Then we'll go this way again. So it's that
Again,
same
it's
concept.
so key that you're in really good posture when you do the rotations.
Yeah.
It's really important.
If you're slouched and doing it, it's like kinking it. It's like,
It's just not going to work well no matter what. And if you use a stick like that, you can actually get a little overpressure on the turn too.
there you go. Yeah.
Now, I've seen people do it this way too, where they just actually grab your arms like this.
Yes.
And you can actually, like, let's say I want to push it that way a little
Yep.
more. I can use my fist here and push it that way as I'm turning like that.
Yep.
Again, I wouldn't do it into a painful direction because that would hurt.
Right.
But if I'm going non-painful and lets me go, I might even do a little overpressure like that
Right.
to
Yep.
take it further.
Bob, we are really giving a lot of our secrets away.
Yeah.
We're going to lose our job.
All right, another one for the mid-back. Quite often, it's just that rounded out posture
Oh,
for the mid-back.
Yep.
And Brad's going to show us in the chair how you can use a ball. Because, again, flexion is bad, so extension might feel better.
Yeah. And we can pretty much, particularly for the mid back, for most people.
Yeah, for most people, this is going to be the
Yeah,
case.
there is you can have stenosis in your mid back, but it's not as common as the low back, I don't think. So I'm going to put the ball wherever it feels comfortable, and I'm going to actually lean over the ball. And you don't have, you can do this. You can put your hands here. You can actually go here. A lot of it depends on your shoulders. If you're comfortable with doing this, and I like Bob's Hallelujah.
Oh, hallelujah
Yeah,
stretch.
yeah.
Yeah.
It's like the Shrek movie, that song Hallelujah. I looked that up. I did, Bob. There's quite a history to that song. And
Okay.
you can even see what it means. It's really interesting.
I'm glad that.
But one way or another, this is a wonderful stretch.
What's nice about the ball is you really can put it in the spot that you need it to
Yeah,
be.
you can see-
You can work up and down.
Yeah.
And it works really well because it's soft, and it's something that most people actually could benefit from.
Right.
As a stretch, especially if you sit for quite a bit.
Yep, just hang on to your ball. And if you've got children, they can also play with it, but they have to bring it back, of course.
That's right.
So is there any other ones, Bob?
No, I think that's enough, Brad. We gave people some golden tips here.
Yeah,
so.
they are completely bored. Anyways,
Brad
once
and
again,
I can fix just about anything
except
a
for,
broken heart, but we're working on it.
and I think the Hallelujah stretch is going in the right direction. It's going to be a whole chapter in the book. Maybe it'll be a pamphlet.
All right. Peace out.